First metatarsocuneiform joint. First, find the head of the first metatarsal. It begins to flare at its base, where the first cuneiform bone projects. Navicular tubercle. Moving proximally along the medial border, the next large bony prominence is the navicular tubercle. The navicular is distally with the three cuneiforms and laterally with the cuboid bone. Head of the talus. Immediately proximal to the navicular, everting the forefoot causes the head of the talus to jut out. If you draw a line between the medial malleolus and the navicular, and then bisect the line, you will be over the head of the talus. Medial malleolus. Move proximal to the distal end of the tibia. Cesticulum tali. Move plantward about 2 centimeters finger width from the distal end of the medial malleolus. It is small and serves as the attachment of the spring ligament. Medial tubercle of the talus. Barely palpable, immediately posterior to the distal end of the malleolus. Fifth metatarsal bone. Lateral side of the ball of the foot, the head of the fifth is usually the most prominent. Styloid process of the fifth metatarsal. After the metatarsal flares, move laterally on the head of the fifth and palpate the protrusion. This is the insertion of the peroneus brevis. Calcaneus. Move proximal along the foot, lateral border. The posterior portion is the calcaneus. Peroneal tubercle. On the calcaneus, distal to the lateral malleolus, separates the peroneus brevis and longus tendon. Lateral medialis, distal end of the tibia on the lateral side. Sinus teresi. Stabilize patient's foot by grasping the calcaneus and place thumb of the free hand in the depression anterior to the lateral malleolus. It contains the excitor digitorum brevis. Dome of the talus. Invert and plantarflex the foot. A small portion of the dome becomes palpable, more to palpable on the lateral side. Inferior tibiofibular joint. Proximal to the talus, can't palpate the joint itself, but you can palpate a slight depression over it.
Dome of the calcaneus. Bare posterior third of the dome protrudes from behind the ankle joint. If you begin at the malleoli and move plantarward and posteriorly, the protruding bone is the calcaneus. The superior portion of the bone that protrudes is the dome of the calcaneus. Medial tubercle of calcaneus. Lies on the medial plantar surface of the calcaneus. Broad and rather large, provides an attachment site for the abductor hallucis muscle medially and the flexor digitorum brevis, and plantar aponeurosis anteriorly. Sesamoid bones. Palpate the longitudinal arch past the base of the first metatarsal bone to the first metatarsophalangeal joint. If you press firmly, you may feel two small bones. Metatarsal bones. Place thumb on the plantar surface and your index finger on the dorsal surface. The metatarsal bones are directly behind the transverse arch of the forefoot. Deltoid ligament, the medial collateral ligament of the ankle joint, just inferior to the medial malleolus. It is broad and strong. Not easy to palpate, only the superficial is palpable in a healthy ankle. Grasp forefoot or calcaneus with one hand and place finger over the deltoid ligament right underneath the medial malleolus. Evert the foot and press down. You should feel a little springy structure. This should be the deltoid ligament. Tibialis posterior tendon. From the medial malleolus, palpate the soft tissue depression between its posterior aspect and the Achilles tendon. The structure is the most anterior, must have the patient invert and plantar flex their foot to palpate. Digitorum longus tendon. Just behind the tibialis posterior tendon and slightly above the malleolus. Have patient flex toes while you resist to palpate. However, it is generally only felt closer to the plantar surface of foot. Flexor hallucis longus tendon cannot be palpated unless symptomatic. It runs along the posterior aspect of the tibia and grooves the posterior aspect of the talus. Posterior tibial artery, between the tendons of the flexor digitorum longus and the flexor hallucis longus. Foot should be relaxed and not weight-bearing. Tibial nerve, posterior and lateral to the posterior tibial nerve, difficult to palpate unless symptomatic. Tibialis anterior tendon. Most prominent, most medial of the three tendons. Instruct the patient to dorsiflex and invert the foot against resistance. Palpate the distally to its insertion on the medial aspect of the base of the first metatarsal and first cuneiform bones. The muscle belly is on the lateral side of the tibial shaft. Extensor hallucis longus tendon. Immediately lateral to the tibialis anterior tendon. Instruct patient to actively extend the great toe. Palpate it along the dorsum of the foot to its insertion into the base of the distal phalanx of the big toe. Extensor digitorum longus tendon lies lateral to the extensor hallucis longus. Palpate it first where it crosses the ankle joint. Have patient extend toes and then palpate the tendon as it splits into 4 parts to the distal phalanx of each of the lesser toes. Dorsal pedal artery lies between the extensor hallucis longus and dorsum of the foot. It's absent 12 to 15% of the time.
First is the anterior talofibular ligament. It undergoes stress when the ankle is inverted and plantar flexed. It runs from the anterior portion of the lateral malleolus to the lateral aspect of the talar neck, most easily palpated in the sinus tarsi. It's difficult to palpate and difficult to palpate a defect in. Next is the calcaneofibular ligament. This stretches plantarward to the lateral wall of the calcaneus. The posterior talofibular ligament. The origin is on the posterior edge of the lateral malleolus, the small tubercle on the calcaneus on the posterior aspect of the talus. Prevents slippage of the fibula onto the talus. Next is the peroneus longus and brevis tendons. These pass behind the lateral malleolus as they cross the ankle joint. Have patient actively evert and plantar flex foot. Then continue to palpate the brevis onto the peroneo tubercle. Peroneus longus is difficult to see, but you will notice one thick tendon and a split. The tendon that runs plantarward can be seen. That is the peroneus longus. The retrocalcaneal bursa lies between the anterior surface of the Achilles tendon and the bare posterior superior angle of the calcaneus. Start at the Achilles tendon, palpate down. Once you get to the calcaneus, you will be pinching the retrocalcaneal bursa. Next is the calcaneal bursa. Move finger outwards superficially. It lies between the Achilles tendon and the overlying skin. The plantar aponeurosis or plantar fascia originates on the medial tuberosity of the calcaneus and splays out to each of the toes. By palpating the plantar aspect of the foot beginning at the calcaneus tuberosity, you should feel a large, smooth nodular surface. Extension of the toes causes the plantar fascia to be more prominent.